Well, good afternoon and welcome to the Small Business Briefing. It's Thursday, December 9th, and we've started to welcome new members on our Thursday edition. So let me take a minute to welcome new member, a basic member, BAM Consulting Group PC, or I'm surely that's BAM Consulting in East Lansing. The owner is Tracy Mullaney. So welcome to Tracy and her team to the Small Business Association of Michigan. And that is brought to you by Marana Group, a data documents and distribution solutions company, a member since 2000, a great sponsor of this briefing. Brian, it's an interesting time. We're coming off of an event last night that some of our members would have known about, maybe not all those who listen to this briefing regularly. We called it passing the torch, and it was sort of symbolic of change of leadership going on here. I'm retiring at the end of the year. You're going to sort of reunite the titles, if you will, of both president and CEO. And it was a very nice event, and congratulations to you again for taking over this organization after the first year.
Yeah, thanks, Rob. And there's it was a wonderful gathering of people. So people from SBAM's history, but of course, everybody in our present are members of volunteer leadership, current and past, and a lot of our supporters as well. So great gathering of people, a lot of good, positive energy about the future, and it's a real honor to lead the organization. I mean, it really is special among small business efforts across America. You know, a lot of people, we take it for granted in Michigan because we have this successful, long-term, robust, and effective small business association that exists solely for the purpose of small business. In most states, there's like a business association that has like a small business department in it. And so it's kind of dominated by the big players, and the small business is kind of a side thing that they do. And but Michigan has been fortunate under your leadership. It has flourished in the last 20 years to the most successful, the biggest state-based small business association in all of America. And so it's quite a legacy that has been built, and it just, this relationship we have with our members, working in the trenches through the pandemic. I'm really excited about what that's going to make possible for our future.
Well, so am I, Brian. I think the future is bright under your leadership, and so I'm looking forward to seeing where you take the organization. But while we were celebrating, the legislature was working last night, and we have a special guest, and I think we could say this is an extra special guest who was there last night working while we were partying. Representative Julie Calley is our guest. Do you want to introduce her and kind of set us up for what happened last night?
You know, I like to say sometimes to people that, little known fact, I actually, way back when in high school, I dated my state representative. And we've also been married for the last 25 years. Now, so Julie's right in the middle. Julie Calley, Representative Julie Calley from District 87, Berry County and Ionia County make up that district, and has been right in the middle of some really big items that have been moving through the process. You've seen a lot in the news about. So, Julie, first of all, thanks for joining us and making time. You're kind of representing the Calley way in the car today. But let's start with the appropriations bill. You sponsored a $1.2 billion supplemental appropriations bill that starts the process or continues the process of allocating the federal dollars and in some pretty key areas. So maybe just touch on what you view to be the highlights or the most important aspects of that supplemental.
Absolutely. So we're all concerned with the number of hospitalizations and deaths that we're seeing. And this supplemental includes a substantial amount of money funding early treatment. We're behind many other states in the way we approach this. So it would set up at least one site in each of the 8 regions around the state. And that site has to be as central as possible. It can't be off in some obscure corner so that it is accessible. We have a number of people who don't have quick or easy access to monoclonal treatment. And that really is what we're focused on right now. So these antibodies have proven to be incredibly effective at keeping people out of the hospital and heading off COVID when it's caught early. So this supplemental includes $50 million for that early treatment capacity, and it also has another $25 million for procurement. So we know the feds are disseminating some of the monoclonal to all states. We want to go ahead and buy more. And that also would apply to any other approved mechanism to combat the virus, such as an antiviral, right, coming out of Pfizer. These are different mechanisms. We want to go ahead and take state money and create a surplus so that we can treat Michiganders faster and better. I think of particular interest to your members also, we set aside $100 million just in case that vaccine mandate went through. It will be available to private employers for their employees who don't choose to get vaccinated but need to test every week. That was going to be an incredibly expensive endeavor, either for the employers or if the employee had to pay for it. The sun came out. We're not used to that in Michigan, so it was not here when we started this conversation. Healthcare recruitment. So there are retention and recruitment grants that will be going out, 75% to our hospitals and another 25% to post-acute care, long-term care facilities, allowing them to support labor in any mechanism that they can. As we know, we're all short-staffed, but obviously we want our hospitals and our nursing homes to be staffed as well as possible to continue care of those who need it most. Interestingly enough, there's a $10 million pilot in there for nursing homes because we didn't realize until COVID hit how many multi-consumer rooms still exist. So a lot of times we picture a nursing home bedroom with one individual in it, but there are actually still a number that have 3 or 4 vulnerable residents together. So this allows the nursing homes to go ahead and convert those to 1 bedroom, therefore being able to contain the virus more easily, but also allowing visitation, which is critical to those who have been impacted. Substantial grants to create laboratory expansions and capacity, and $300 million for school testing. We actually have been funding that fully. There's been some misinformation in the news, but this allows clarification that there's more than enough to take care of not only our students, but our teachers. We've been hearing that some of our schools were a little bit concerned about using testing kits on their teachers, but obviously if we don't have staff, we can't have school open. So we wanted to give our schools more than enough assurance that that testing capacity would be there. And
if I could, there's a just a finer point on a few things. These are really, this particular supplemental, even though we think in terms of like direct business interaction, but testing in schools and teachers and students, and the ability to do that, it's been maintained all along. And I did see a few articles that suggested that maybe there wasn't enough in testing, but that the resources were previously and now are currently being continued to make that available. But for childcare purposes, schools being open and available is really, really important to employers. And that and the idea of the supplemental supports all the same vaccine work before, but also really, really gets in on and ahead of treatment options. So, you got the current monoclonal treatment and to really lean into that as a strategy, which helps both people who are unvaccinated, but also those who are vaccinated, that it has benefits to, because there are breakthrough cases, especially with the elderly, that that type of treatment has proven to be extremely effective. And there's new treatments on the horizon. And so the legislature is taking the proactive step of having resources that are available for that. And then, of course, hospital staffing. I mean, those are all really, really critical areas that make a big difference. And I think that the process that this went through happens to be, you're the sponsor of the bill, but I promise I'm not just sucking up here. This is that the process that the House went through to put this supplemental together in a way that both deals with the direct issues that we have problems with now, but also anticipates what some of the future needs are going to be, including if this vaccine and testing mandate at the federal level goes into effect, We're going to talk about that later on. Maybe it will, maybe it won't. But if it does, the legislature has taken the proactive step of saying that we need to help workers and employers pay for the costs of that mandate going into effect. Now, so let's move on to the next, the other issue I wanted to touch on with you, which is which is economic development. So everybody's seen in the news that these big projects, and Ford put a big battery plant, or is putting a big battery plant in Tennessee and then Kentucky as well, and not Michigan. And how do we put ourselves in line? So everybody knows about that conversation, but the House is actually right alongside that and said, okay, we're going to talk about economic development, but also small business economic development is important too. And there was a bill that almost without notice passed yesterday that is pretty important to small business. This was sponsored by Representative Steve Johnson, who's been a guest on this show in the past too. What does that small business, the beginning of small business support look like?
Yeah, I appreciate the question. And because the economic development package has been moving, it's really given us an opportunity to leverage the cause of small business itself, right? We are not going to focus on only one size employer. So this conversation that has been going on and this focus has actually allowed us to leverage that and bring in some small business support. And I think the time is critical because we're not going to leave Lansing without wins from Main Street. And so the bill that you asked about specifically would alter the $80,000 exemption for personal property tax and double it.
So, a lot of our members out there, you might recall that back in 2015, we had the beginning of the implementation of a phase out of the industrial personal property tax for commercial personal property tax, which frankly is most of our members pay for commercial personal property tax. There was an $80,000 exemption put into place. So if your total equipment value is less than $80,000, you're exempt. What the legislature is saying now is that up to $160,000 would be exempt. So that passed the House. Still has to go through the process, but it looks like it has good momentum. Hearing a lot of other discussion of other things for small business support being kicked around as well. So I really do appreciate you taking some time out of your schedule to talk to us about this, but also to leverage the big business support going through in order to create momentum for some additional small business support as well. Thank you, Julie, for joining us.
Thank you. Have a good day.
Thank you, Representative Calley. We appreciate your support.
Hi, Rob.
All right. So, Brian, that maybe just to put that in a little bit of context. So there is a larger package. It's really setting aside money for big industrial projects. So Michigan doesn't lose another one of these big projects. It puts money into site preparation and an incentive plan. A lot of people think that's GM driven, that there is a big project in the wings and Michigan doesn't want to lose that one. Is that why they're pushing this through so quickly? And would you just kind of explain a little bit about the effect of adding the small business support to it, whether it helped or hurt?
Yeah, so it's been all over the news that they're looking at economic development. The people that are involved in order to evaluate, okay, are these deals that we really want to go this far and create a whole program for? The fact that public officials that were kind of read into private industry plans had to sign non-disclosure agreements tells me that there are real and substantial deals out there right now. And so I think the reason that this is kind of fast-tracked is because, these decisions are being made at the speed of business, not at the speed of government. And so government has to match that in order to be in on it. But the idea of large incentives for specific projects, those are very controversial. Some have worked out really well. Others have not worked out really well. And so this makes it very controversial. Not our, in terms of our members don't generally qualify for those types of incentives. So this is not the sort of thing that we would be out there in the trenches working on. But when something moves like this and there's discussion, it is a good opportunity for us to say, okay, if you're looking at support for the big operators, for the global players, we'd like to remind you that that everybody always says that small business is the backbone of the economy. Here's a good opportunity to show that you really believe it. And what I appreciate about the House's approach here is that, the bill that passed yesterday was one piece. There's a bunch of other stuff that's on the table too that I think next week we'll be able to, it'll settle and we'll know exactly what it all looks like. But I think that actually, by doing small business support, it makes the process of getting something done easier, not harder. A lot of times in government, you have something moving through the process, other components get added, and it makes it heavier and harder to pass. When you support small business, that's the sort of thing that people across the political spectrum in every community in our state support in a big way. So I think they're both policy and politically smart to add in small business support, and I think that there's an appetite to go to do more and to go deeper. So this was a good first step. Commercial personal property tax, it's an expense, but also kind of a pain to administer. So to have more small parcels, up to 160,000, totally exempt from the process would be a big step. There was one other item that passed yesterday too that I thought I'd mention, is that it's a continuation of the policy to say, okay, people working remotely, and there's a bunch of commercial equipment like computers that used to be in one jurisdiction and have moved to a different jurisdiction. And for the sake of it not having to make payments to all these different counties and townships and cities where your employees live, they allow you to just pay wherever the equipment was in 2019. You can pay it that way in 2021 for the administrative ease of it. So a couple of things that passed, and I think generally heading in a good direction and nice momentum towards small business support.
So just again, a little context. It has now passed the House. It has two more steps. It'll have to pass the Senate and get signed by the governor to become law. So we're as usual, we're watching, but we don't usually talk about things we don't think have any chance of passing. So we'll keep you up to speed on this. Let's talk about some things that are going on again in the sort of COVID world. It looks like the FDA, the Federal Drug Administration, or the Food and Drug Administration is about to approve, or they have approved, I guess, the Merck antiviral, and maybe have some others in the waiting room. So antivirals could become more part of the solution here in the very near future.
The key to the effectiveness of the treatments is really about when you start it. So earlier, but if you don't wait until you get severe disease to start antiviral treatments, you have better success with the outcomes. So both with Merck and Pfizer. So Merck's didn't turn out to be as effective, but still no downside and helpful in some cases. And then the Pfizer antiviral, which is a little bit behind in the approval process, but kind of queued up to go. Very, very effective. As Julie just mentioned, that's on top of the monoclonal antibody treatments, which have proven to be highly effective. But there's been such focus on vaccines that the idea of early treatment given a positive infection, there hasn't been as much discussion on that, and so this there's a lot of tools that are coming to bear, and that gives me more confidence about controlling the most extreme outcomes of the virus in the future. So the virus mutates, and we're going to talk about that in a minute. But but the fact that the treatments are getting better and the policymakers are thinking about earlier interventions, getting everything lined up for when these approvals happen, I think it's a shift. It signals a shift in government to be more proactive, but also leaning into the the treatment interventions more than what we maybe have seen before.
All right. So speaking of this, the Omicron strain that everybody's been talking about is beginning to look like it may not be as dangerous, maybe as contagious or more as the Delta, but maybe not as as deadly. Which sort of brings me to the public policy response. It seems as though that there are those who are just waiting for the next new thing to come along in order to jump into some new public policy area. New York City, we talked about on Monday, has a vaccine mandate for every business in New York City. And it seems like such an overreach, but it was the idea of the Omicron virus or strain of the virus that really pushed them in that way. So what do we know about Omicron at this point, and what lessons might we take from a public policy response?
The way that the study and the research, it's only going to be a few weeks before we know a lot more than what we know today. And so the public policymakers, I think, would do well to not predetermine what your response to Omicron is going to be before you get the actual data on what it should be. And so I'm not surprised to see what New York City has done. It would be wildly inappropriate, though, to make big shifts in policy before we know a lot more. So what do we know so far about it? Well, first of all, it looks like it is more contagious. The most recent study, and these are still small and short term, but the most recent that I had read as of even this morning suggested that it could be upwards of twice as contagious as Delta. Remember, Delta was about 7 to 8 times more contagious than the original strain of the virus. So you really are getting into multiples. That if you do the math, it's 14 to 16 times more contagious than the original coronavirus we were dealing with in 2020. So from a contagious standpoint, and that's not unusual for viruses to evolve this way, to get more contagious, so as they spread. But in terms of the severity of the disease, there are a lot of factors in this. Now, it looks like no more dangerous. I think there's a growing consensus of no more dangerous, maybe a little less severe. But the factors that are hard in this area to really determine in terms of severity, you do have some protection from vaccines. Part of it looks like it's less severe, but the population has more natural and vaccine immunity in it. So is the virus really less severe, or is it just that the humans have more kind of natural antibodies in the system? Either way, the outcome looks like maybe a little less severe. The other thing that is a little bit complicated to determine this, it's a lot of statistical work that has to happen, is that the age of people that have been infected tends to be younger. So you have more data on younger people than older people. That won't be the case for much longer. This one appears to really move fast, and then once it moves into older populations, and you get more data, and unfortunately, it's likely to be harder on older people, just like every other strain has been. So the jury's still out on that, but it's important that we get that information, because we're also learning about how well vaccines perform against this strain, and the laboratory tests. So there's the field work that's happening, but the laboratory tests that Pfizer has recently published show that the original regimen of the Pfizer vaccine, 2 doses, that for most of us happened quite some time ago, that there's a lot less protection from infection, but maybe similar protection against severe disease. So in other words, with the original 2-shot of Pfizer, with Omicron, you're going to end up, a breakthrough case is much more likely, but the severity of the case Probably not. But they also looked in the laboratory of the effect of the booster, and the booster does appear to, again, not in the field, in the laboratory, the booster appears to perform similar against Omicron as compared to 2 shots against Delta. And that's very, very good news. And but again, all this, there's a bunch of moving pieces in this data, so many changing factors that it takes you have to look at these things from different points of view, and then you bring it all together and you hope to be able to come to a consensus. But the main point of it, and where you started this discussion, Rob, is that there's still a lot we don't know. And doing something for the sake of doing something is not the right approach. It won't take long to have. Every day we learn a lot more about this strain, and so within just a few weeks, I think we'll be in a much, much better position to determine what types of actions might be necessary.
Well, one of those actions, and I mentioned New York City is a vaccine mandate. And while it's interesting what's happening in New York City, the question for us is what's happening in Michigan. And so we watch to see if there's signals from our governor about whether a vaccine mandate is any form of one is in the offing. She may have tipped her hat a little bit recently in an interview. What do you make of this?
She was talking to a group of small business owners in Greenville, Michigan, and there was the Greenville Daily News was in there. Well familiar with that reporter and that community and that newspaper. They did great work, and so it was a remarkably candid conversation. Somebody had said, "Hey, I'm worried about hiring, staffing up already, and if I lose even any employees." And the governor said, I share that concern. The state of Michigan is an employer also. If we did a mandate, we will lose employees, and we can't afford to lose employees. And it was the first time you heard something that was kind of like leaning away from, like, hey, I don't really want to go here either. Now, was that a policy position on the federal mandate? It wasn't delivered that way, but you could see why people would ask the question, well, do you support the federal policy mandate? Now, the administration has not responded to follow-up questions on that specific point. Does this mean you oppose the federal mandate? But, and I doubt that the governor will formally oppose it. But I think it was reassuring to employers to hear the governor thinking about this like an employer. The state of Michigan is an employer that has to get work done. And so that's the same type of struggle that our members face. They have businesses that have work that has to get done, and we're already short-staffed, and this is a big risk.
All right. Nothing really new on the legal front on vaccine mandates, so we'll continue to watch that. We'll maybe on Monday's briefing give you an update on that. Let's do one thing that's sort of unrelated. Michigan passed a change to auto insurance, the way auto insurance is administered in Michigan, and people are about to get a happy surprise, I think, as a result of that legislation and the consequence of that legislation.
The legislation that passed before, it had a provision to review the Michigan Catastrophic Claims Fund. So every time you pay your premium, a portion of that goes into the Catastrophic Claims Fund to pay for the most expensive car accident cases, health costs, and including up to lifetime coverage of the cost of severe car accidents. Well, it had in there a review when they did the reform to try to lower the costs. Do you get what if they have, if there's excess, what happens? Well, a check gets sent back. $400 per driver won't be until the next, probably second quarter of next year. But that was announced recently, and it's and so we do expect that second quarter's Catastrophic Claims Fund will make payments of we'll make payments of $400 per vehicle. That'll for anybody who pays it, including your business, should expect to see that refund coming. All
right, so that includes businesses, and so if you have a business-owned auto or a fleet of autos, it's $400 per automobile, personally and business. So you can look forward to that. Brian, I'm going to let you recover and go ahead and sign off. Thanks for joining us today. This is the small business briefing. We've got a number of things we're watching. We'll be back on Monday, and we'll see you then. Remember to shop small this season.
All season long. Thank you all.